Hey guys, how we doing today? Um, Today I'm doing a video on a dog's pain and how to do like a good assessment on your dog. Um, but first, coffee. So I'm going to be using my oldest male Anatolian Shepherd dog, Shiloh. Shiloh is how old is Shy now? 6, 7. And he just started. Well, I'm going to give you the full story. So about a month ago, I noticed something was off with him. And I couldn't put my finger on it, but when you have these dogs for a long time, you just get to know them. So anybody that, you've had a dog a long time or a cat, I mean, any animal, you know them. Even before like proper symptoms show up, you can just get a feeling that something is off. So like probably a month ago, I said to the husband, something's wrong. Like I can't put my finger on it, but something's wrong. And he would go out and look at him and he'd be like, he's fine. There's nothing wrong with him. And I'd be like, but my gut says something is wrong. He looks fine, but his eyes are telling me something's wrong. So not long after that, he started kind of this achy pain kind of a walk, and I could tell that it wasn't like a generalized. So we hung out and I watched him, and pretty soon I could pinpoint, okay, it's his front left leg. Just kind of a little hitch to it, just a little, couldn't even tell at that point for sure where in the leg it was bothering him, but I knew that it was the front left leg. So look at his paw, look in the paw pads. These dogs are out working 24 hours a day, so God only knows what they can get into. There was nothing visibly wrong, no puncture wounds, no visible injury. Okay, we'll just keep an eye on it, see if things loosen up. Maybe he ran on it wrong, twisted it, something, right? And it just got progressively worse to the point where there was no misunderstanding where this was. You knew for sure it was the left leg. It was visibly now kind of favoring it. So started an aspirin regimen. Now, aspirin is safe for dogs so long as it's buffered aspirin. So buffered aspirin has that special protective coating just to help their stomach lining and their gut. Otherwise, they can get gut rot and it can just get ulcerative and nasty if you have them on it for long periods of time. So Shy weighs probably, I'm going to guesstimate 130 to 140. So what he can have is, we have 325 milligram aspirin. So they make baby aspirin at 81 milligrams, and then they make a regular normal aspirin at 325 milligrams. So he can have 2 325 milligram tablets twice daily. Okay, so break them up every 12 hours. So I've been doing that, but not religiously and as scheduled as it should be. But when I did do it, I really wasn't noticing a lot of improvement for him. Yesterday, I noticed now I can see there's swelling in that left joint, very like what would be our knee, I guess. So not his ankle, but up a little higher. Nothing feels broken. It's not hot to the touch. So like I said, I don't think it's broken. He can flex it. He can bend it. He's putting weight on it, but he is favoring it. So I'm thinking some type of a tissue injury, a sprain, a something, but I don't like it. So what I'm doing is we're going to now schedule this aspirin, 325 milligrams, 2 tablets twice daily. And what I did today is I pulled him out of the pasture today. His assignment is an important one where we normally will get predation come at us from the north. And so that's the pen that he is in. So he is with our goats, and he is with moms and babies. So his assignment is a pretty important one. He is by far the best guard that we have. He and our girl Athena are a tight 2 for first and second place, but he's amazing. So it's a big deal to have to pull him off. So bad guys usually come out at night. So what I'm going to do is I'm going to pull him, put him in a stall. He's behind me right now, and let him rest. And if he's very unhappy in there at nighttime, he can go back out to work. Now, and then repeat in daytime to rest and out to work at night. Now, excuse me. If he was the kind of dog that was okay with taking PTO in the house, I would do that. I'd pull him into the house. He could go take some PTO and rest it out. He is not a dog that is okay with PTO. And if he has to take PTO, he is not going to take it in the house because that is just not his gig. He wants to be outside where the action is, where his animals are. So that's fine. So we're going to kind of feel this out and see how it is. Now, normally, if I have a dog that's acting painful because of where our location is, because of the time of the year that it is, right now we're in the middle of April, and because of past experience of dogs that I've had over the years on this farm, the number one thing that I think of when I see a dog being painful is Lyme's disease. And this year is a gnarly year. It's bad. It's ugly. Guys, stay on top of your flea and tick stuff, please. So the first thing I thought of when I started seeing him painful was, oh, Lyme's disease. But he's not presenting that way, okay? It's not a real generalized pain or an ache. He doesn't have a fever. He has an appetite. He's eating and drinking. So all the things that our dogs normally present with when they have Lyme's or anaplasmosis specifically is what we've had, which is worse than Lyme's disease, in my opinion, but it's still a tick disease. They usually will present with wicked pain, like crying when they have to get up. They don't want to eat. They don't want to drink. They're crying when they have to move. They usually have whopping fevers. There's no mistaking when they come down with this, okay? The other thing to remember with livestock guardian dogs is they are bred and created to be big, mean, bravado, confident. I'm keeping the bad guys away. And how do you do that? Even when you're in pain, you still have to push through and do your job. So by the time that you see them presenting with problems, it's probably been hanging out for a while, and it's probably really, really bothering them because it's their job to not show weakness. So dumb me, when I had the gut feeling that something was off with him initially, I should have not been so passive on it. And I should have immediately, I don't know, something. I don't know. But I can't go back and I can't change it. So I'm doing what I can right now. So that's the big thing. When your dogs start acting off, be aggressive and look into it. Okay, especially with these livestock guardian dogs, because they're created that you don't show your weakness, because the weakness are the first ones to get popped off. So they try to be very brave front. So we are going to, like I said, just keep him in a stall, do the aspirin, see if that helps. Am I anti-vet? Absolutely not. We have a phenomenal vet clinic that we go through that's comprised of, I think they have 3 vets in there right now. Every one of them are fantastic vets. They're our go-tos, but getting into a vet right now is very challenging. You can get in for emergency situations, but something like this even is going to be a few weeks till he can get in. I can guarantee it. So for the time being, I'm going to treat like this. This is not emergent. This is not life-altering, in my opinion, at this point. So I'll make an appointment and we'll ride it out until then. He really needs an x-ray, is in my personal opinion, to see what's going on in there to get a really good idea. So we need an x-ray for him. Let's see, I'll bring him out for you here. I'm going to shut my other door first. 1 second. All right, it's really, really windy here today. So yeah, we need, in my opinion, an x-ray. And then they would probably put him on steroids and something better than aspirin for his pain. So we're not going very far here. So, hey, shy baby. Let me see if I can get this thing pointed down at all. Hi, handsome. So where it is, I don't even know if you can see, get your big old melon out of the way, right in here. You can see that joint is swollen up. Yeah, we don't want to stand on it. Can you see? Back up a little bit, but good job. I don't know how well you can see this one on this side. You know. And I've had people ask, how do you get meds in them? Him, I just put his head back, open it up, and we just drop the 2 tablets right in the mouth, close it, and I just kiss the heck out of him until he swallows. It's not hard. That's how we get meds in here. That's what we do. You're not getting out that way. You're going, honey, we're going to bed. Come on. There you go. Good job, buddy. Yep, you're resting it off today. Good boy. Take a rest. Other people, peanut butter is a good one because it's real sticky. So you can just stick pills in that whole a lot of times. Some people do hot dogs, cut the hot dogs in blocks and shove the pills in the middle of that. Some people will crush them up, mix them with yogurt. You get creative sometimes when you have to, but it's important to get meds in or else you have real unhappy dogs. So that's what's going on with Shiloh. I will keep you guys posted and up to date what happens. Send us some good juju, though. This guy is my heart, my soul. This would be a hard one if something more sinister is happening. Of course, me being me, right away I'm like bone cancer because I'm just paranoid and I'm a warrior. So, but I'll keep you guys updated. So, thanks.